To check spinal reflexes, I like the animal on his side and usually enlist the help of the owner to keep them as relaxed as possible. Let's start with the rear limb first. I use different parts of the hammer for different reflexes. So the one that everybody seems to check is the patella reflex. So since that's a tendon, I use the fat part, the broad part of my hammer. And I get a nice response there. You can check it a couple of times. For the cranial tibial reflex, I use the pointy part because I'm hitting the muscle belly of the cranial tibial muscle. And I get a nice response there. For the gastrocnemius reflex, I want tension on the gastrocnemius tendon. So I'll put the hock into a right angle and a little bit forward, and I'll use the broad part of my hammer. And you get a nice reflex up all the way usually into the semis as well. To check sensation, I use my fingernail and I gently pinch, and you want to see flexion of all of the joints. In an animal that I suspect spinal cord disease, I'll check not just the lateral toe, but the medial toe and make sure I get that response as well. In an animal that has no motor ability and no conscious proprioception, it's very important to check what's called deep pain sensation. And for that, I usually start with my finger. If I don't get a normal response, then I'll use something stronger like a hemostat. But what I'm looking for is not just the flexion, which is a reflex, but conscious awareness that he feels something painful on his toe. So I want the dog to turn around and give me some acknowledgement that he's feeling that. The other thing that I do when they're down in a lateral position is an orthopedic exam. So I flex and extend each joint. I palpate the bones for any lumps or bumps, looking for any arthritis in the joints. For the stifle, I want to do a cranial drawer movement and make sure that there isn't a ruptured cruciate. Thrust. I look for patella luxations. Palpate all the way up the leg, flex and extend each hip, looking for any arthritis. In a young dog, I might want to do an Ortolani sign if he has an abnormal gait in the rear. Front limb reflexes can be a bit more challenging. I usually start with the biceps reflex. So with my finger, I'm grabbing the second tendon, not the first one, but the second one, and I'm pulling the limb all the way back. So putting tension on the biceps muscle and tendon. And then I'm hitting my finger, and you get a nice biceps reflex right here. Okay? And I'm using the pointy part of my hammer. The extensor carpi radialis is this muscle right here. Okay? And I want the carpus to extend, so I have it initially in flexion. And I'm hitting the muscle belly, so I'm using the pointy part of my hammer. And you get a nice response. For the triceps muscle, again, you want to put tension on that tendon. You're hitting down here. So I just leave it in this position, and I'm hitting a tendon, so I use the broad part of the hammer. And I get a nice response here. For flexion, do the same thing as in the rear limbs. I take the outer toe and just use my finger, and I get a nice response, and everything is flexing. In some animals, I might check medially as well. The other thing I do is an orthopedic exam on this limb. So I flex and extend each toe, each joint, palpate for arthritis, any bony lumps or bumps, any effusion of the joints up the limb, the elbow, the shoulder. I flex and I extend as well. And then along the shoulder blade and into the lower neck area.